Their circulation to the skin is their color. Are they pink? Are they blue around the lips? Are they mottled? What do they look like? If at any point that you look at this child across the room and you say that child looks sick or looks bad, you don't leave them out there, you bring them back right away and you start caring for them. Because children, unlike adults, will compensate, and they go and they compensate, and then they just fall. And once they fall, it's really hard to bring them back up. Adults will do that gradually, kids don't. They go until they can't go anymore. So just know that. Once you're able to look at the child a little bit better, make sure you get them completely undressed. Okay, get them out of the onesie, get them out of the car carrier, and get them completely undressed. And you're going to be looking again at how they're breathing, too fast, too slow. Are they having retractions as signs of respiratory distress? You're going to count the respiratory rate for a full minute, and the reason we're asking for that is because kids are irregular breathers. So even though you may take the respiratory rate for a full 15 seconds and multiply by 4 like we're taught in adults, you may come up with a respiratory rate of 24, when in reality it's more like 58 or 68 because of their irregular breathing pattern. Once you keep the respiratory rate done and you look at the assessment, and you're going to do the rectal temp, we ask that the rectal temp be done age 3 or younger. Always take the opportunity to look at the child to look for any signs of abuse. A lot of times, especially in the little babies, the abuse happens where the diaper area is because it's covered and people don't see it. So look for any burns or bruises or anything that you may consider abuse. If you do consider it, you're required by law to report it to Child Protective Services. The phone number is 196 abuse. If you don't remember it, the secretaries have it. It's always better to report than not report it and something bad happened to your baby. You want to take the diaper off and you want to get a weight. Weight is very important in children because our dosages and medications and IV fluids are calculated according to the weight that you're getting. If for some reason your baby is lethargic and just really sick and you don't have that couple of seconds to weigh that child, you bring them straight back into one of the treatment rooms, and then you get the Broslo tape. Have you ever used the Broslo tape before? Okay. The Broslo tape is basically a measuring tool that gives you an idea of what the weight may be according to the size of the child. So what you do is you put this and you lay it against the stretcher with the child at the very top, and you can see on the tape it says measure from this end. So that's where you start at the head. Okay. And then what you do is you extend the leg down, and you don't put the toes down, but you measure up to the heel. And then that's going to land on a certain color. And it gives you an estimated weight of the child. It also tells you the size of equipment you should be using and some drug calculations. We have the Broslo cart in room 14. So if this child fell in the gray area, you will open the gray cart, and in that cart you would find all the supplies that you need to take care of this child. Know that there's no medications in there. All medications are on the first drawer of the adult crash cart for pediatric patients. So once you're able to see the estimated weight, then they can go ahead and start giving medications or IV fluids. But as soon as you can, you still need to get the accurate weight, because that's very, very important. Whenever you go to put an IV in a child, or even maybe do a heel stick if you're doing like a bilirubin check, it's always a good idea to get a blood sugar. Okay, kids, unlike adults, cannot make their bodies change from glycogen through the liver to glucose. They don't have the ability to do that. So whenever they're under stress, meaning they have fever, they're scared, they're crying, their blood sugar reserves fall really quick. So it's very important to know what the blood sugar is. The other important thing with children, once you get them undressed, to look at all the assessments, cover them, because they cannot maintain their body temperature, and they can get hypothermic very, very quickly.
When you guys do the glucose testing on babies, where do you take it from?
Wherever you're getting, it could be the finger, it could be the heel, it could be from the IV stick, it's wherever, it does not matter as long as you get the sugar. Let's see. Your other parts of your assessment on the children is you're going to look at the fontanelles. Soft and flat is good. If it's depressed, maybe a sign of dehydration. If it's bulging, it's probably a sign of increased intracranial pressure, which could be from trauma, or it can be from like hydrocephalus, some kind of anomaly going on. So check that. Your capillary refill is checked at the very heel. You just press them, let go. It should be between 2 to 3 seconds. Anything that's delayed, they may need fluids or they may be septic. So make sure you know about that. The number one cause of cardiac arrest in children is a breathing issue or lack of oxygen. So make sure they get oxygen as soon as possible if that's what they need. know your normal vital signs. If you have a 3-month-old presenting with a heart rate of 76, you should be concerned because it's very, very low. The littler they are, the higher the heart rate, the higher the respiratory rate. And then as they grow older, it decreases. Things that can make your heart rate go fast would be fever, or if they're crying or they're upset, or pain. Children have pain just like adults, and just like adults, they can compensate that with their heart rate being high. But you need to know what the normal is so that you know what the abnormal is. Okay? If you're having to cardiovert a baby, use a pediatric pads, the pink ones. It's age 8 or younger. And for little tiny babies, you could go front to back. As they grow older, just like adults, front to side. And then you would cardiovert them with 2 to 4 joules per kilogram if you need to do that. Defibrillation in children is very, very rare. Usually, if they get sick, they start sinus tachycardia, normal sinus rhythm, bradycardia, and then asystole. And then by then you're done. They go never. I think we covered anything. The last thing in children, if you don't know what's going on, they're not acting normal, you can't account why their heart rate's high, do a urine drug screen. Everything in children goes in their mouths. Well, it could be a pill, it could be crack cocaine, it could be anything. So always do a drug screen, just to make sure that they haven't gotten into anything. Questions?
Do you guys straight cath them, or you just put a bag on them? And
We don't like the bags because, number one, if you're having to send it for infection, it's not a clean specimen, so always cap them. If it's a true emergency, you're not going to wait for that baby to pee in a bag. So you need to do a catheter, unless there's some indication why you can't do it. Any contraindications? Questions? Babies are very easy. They like a couple things. They like oxygen. They love oxygen. They like to be wet. They like to not be dehydrated. They like to be warm, and they like to be sweet. So if you get all that in together, your baby's going to be happy. That's it. Questions?
No.
Okay.